We are live on YouTube. Good afternoon and welcome to iSampark webinar semi initiative of Bhargav Phyto Lab. My name is Ishmeet and I welcome all the doctors, students, and interns to this iSampark platform, which is sponsored by Spondent Drops. So, in today's iSampark webinar, we have a very young doctor with us, Dr. Viren Nimberg, who is an MD homeopath from Rajkot. He is also associated with Rajkot Homeopathic Medical College as assistant professor at Department of Surgery, and today he is here to talk on renal calculi and its homeopathic management. So, Dr. Viren, we welcome you. Before we start with the session, we will have a brief agenda about the introduction to know what Bhargav Phytolab is. I hope you are all a part of our iSampark webinar series and you all are aware about the Bhargav Phytolab. We are a homeopathic multinational company, started our base from India, from a very small town, Bulandshahr, and today we are there in across more than 34 countries across the globe. We are into homeopathic medicine manufacturers. We are basically the manufacturers of homeopathic medicines. We are also doing the research and development, manufacturing, sales, and marketing of all the medicines which are related to homeopathy. These are the nations where we have our presence, and it's around more than 34 countries. And we are celebrating 100 years journey of serving homeopathy in and around country. So we welcome to the iSampark webinar semi initiative. We also invite doctors to come and start taking Facebook live sessions to get in touch with maximum number of patients, general public, and to increase awareness of homeopathy. We are very soon coming up with a platform with the name GoDoc, which is going to be there for all the homeopathic doctors exclusively for you all to, which will enable you to consult to your patients digitally. We have in-house journal with the name Beyond Practice, and the sponsored brand for the day is Spondent Drops, which is the most trusted brand by homeopathic doctors for neck and shoulder pain or cervical spondylitis. Also, we would like to tell you about another product of our company, which is internationally acclaimed. The name of the product is Kid Flame Tablets, which is for renal calculi and renal inflammation. Kid Flame Tablets is an internationally acclaimed researched product of ours, which is basically a branded formulation containing Berberis vulgaris, Cantharis, Dioscorea villosa, Petroselinum, Stigmata, Thuja occident, Ova ursi, and Vesicaria. This product has been researched in Indian patients as well as on international patients. This is for renal calculi, kidney stones, and inflammation. So, not taking much time, I would request Dr. Viren to please share his screen and take us through the session on renal calculi. Over to you, Dr. Viren. Thank you so much for accepting the request and being here for the webinar as a speaker. Over to you, sir.
Thank you very much, ma'am. Good evening to all the participants. I would like, first of all, thankful for the God for giving such an opportunity. I am also very much thankful for the I Sampark webinar series organized by Bhargava Phytolaka Lab, as well as I am very much thankful for the director and the president of the Parul University. I am also very much thankful for the principal sir, Dr. Hitarth Mehta sir of Rajkot Homeopathic Medical College to give such an opportunity in presenting such a national stage. I am also very much thankful for all the participants to listen carefully and to nourish the knowledge. Okay, now we will further on move to the topic. First of all, talking about the anatomy of kidneys. Kidney is termed as a renal, and also the related things which are also termed as a renal. The Latin word rene, which is being used for the term renal, and then further on it is utilized by the late Latin language, and then further on it is also utilized by the French. Ultimately, we will get some knowledge or the discussion about the renal stone as well as the calculus. The process is known as lithiasis, the formation of stone creation, concretion, that is the calculus in the body. It is also often being formed in the gallbladder, known as cholelithiasis. It occurs more frequently in the male than in female patient, and also by the color of tone of the skin. It is also more often possible in the white tone skin color rather than black. It is very rare condition for the children, but sometimes the cystine stone may occur in the children which is congenitally formed. Okay, we will also discuss further on in detail. It is majorly from the familiar predisposition. Otherwise, no such etiological condition which is being found that is possibly for the formation of urinary calculus or renal stone. It is composed of the urinary salt bound together by a colloidal matrix of organic materials. It is consisting of a nucleus which is surrounded by the concentric layers of urinary salts. Okay. Here in this diagram you may get some knowledge about the anatomical parts of the kidney, the ureter. First of all, the renal pelvis. Kidney is divided into two parts, the cortex surrounding portion and the medulla. In medulla there are minor calyx and major calyx which is forming the functional unit of the kidney. Okay, it is consisting of the glomerulus. Now, further on, over the renal calculus etiology, the causes, different causes for the renal calculus. The first thing, that is the hyper excretion of relatively insoluble urinary constituents. There are five different such insoluble urinary constituents. The first is the oxalate, second is calcium, third is uric acid, fourth cystine, and the fifth, that is drug induced stone. We will discuss the first thing, that is the oxalate, which is in the largest amount in the vegetarian with the cabbage, rhubarb, spinach, tomatoes, black tea and cocoa. Oxalate is the largest amount in all such things. Ingestion of excessive amount of ascorbic acid and orange juice, which is also causing the oxalate intake in the largest. But as our digestive system is not utilizing all such oxalate, it is majorly excreted. So the oxalate stones are more prominently seen in the cases of vegetarians as well. Primary hyperoxaluria is a rare genetic disorder affecting the metabolism of glyoxalic acid, which forms oxalate rather than other soluble end products. It is an important cause of the nephrolithiasis in children, that is the glyoxalic acid, which is formed in the congenitally by the genetic causes. The child could suffer from the urinary stone. Now, further on, the second insoluble urinary constituent, that is calcium, which is again the major portion of the vegetarians, milk and cheese, milk products. Nowadays, the vegans, which are being very least to being affected from such constituent, but the milk and dietary protein also causes the increased absorption of calcium from the intestine. The primary hyperparathyroidism also causes the hypercalciuria and idiopathic hypercalciuria, which is the major cause for the formation of renal calculi. So the calcium stones, oxalate stones, this both type of renal calculi are majorly found. We will also discuss further on in the types of renal calculi. Third material, that is uric acid. It is majorly found that uric acid diathesis, or the increased amount of uric acid constitution over such patients who are suffering along with the gout. Okay, renal calculi patient who are suffering from the gout may associate it with the uric acid stone. Many uric acid stone formers have normal urinary uric acid level but shows a consistently low urinary pH. So the renal function test, in short RFT, which is very much important to understand the renal calculi. It is not like that you will take only the X-ray and just go further on over the management portion, but to diagnose which type of urine calculi is there, the urine function, renal function test, the urine routine microscopic as well as the blood test, which are being very much helpful. And then further on, it will be the best for the management of renal calculi. Lastly, but not the least, the cystine. Cystine stones are typically congenital stone. The cystinuria, which is a hereditary disease, we will discuss it in detail. In the drug-induced stones, majorly the magnesium trisilicate, which is used for the management of the peptic ulcer, which will further on cause the renal calculi. Now, the physical changes, which are also being uh, exciting as well as the maintaining factor for the urinary calculus. The first thing, that is urinary pH, which may decrease. Urinary pH lower than 7 to 6 is the major cause for the formation of renal calculi. Colloidal contact, decreased concentration of crystalloids. It will be immediately helped in such cases of the decreased concentration of crystalloid by taking the water. Okay, it is suggested that the urine output must be more than 2.5 liter per day in cases of renal calculi. So the water intake must be around 5 to 6 liters to maintain, along with the environmental conditions, to maintain the urine output above the 2.5 liter. Okay, and then further on it will be helpful for the decreased concentration of crystalloids. Excessive water loss in the febrile disease in hot climate due to excessive perspiration, due to excessive water loss from the vomiting and diarrhea. This all conditions will also cause the decreased concentration of crystalloid, and then further on it may complicated with the formation of renal calculi. Urinary magnesium and calcium ratio, which is being decreased in the cases of the use of acetazolamide. Okay, and then it is related with the increased incidence of stone formation. Altered urinary crystalloids and colloids. Urinary crystalloids are like oxalate, calcium cystine, uric acid, etc. The urinary colloids are mucin and chondroitin, sulfuric acid. When there is imbalance in the crystalloid and colloid ratio, either there is increase in the crystalloid level or fall in the colloid level. Okay, so either the urinary constituent which are insoluble will increase, or further on the colloid will be increased. If there is any modification of the colloid, like the solvent action or adhesive property, urinary stone may develop. Okay, so if the colloid will be any time at any level, if it is being damaged, then further on also calculus could be formed, but majorly the amount of the crystalloid which is increased, the oxalate and calcium which is majorly increased, and it forms the renal calculus. Decreased urinary output of citrate. Presence of citrate in the urine which keeps relatively insoluble calcium phosphate and carbonate in solution. Vitamin A deficiency in the northern India, northern part of Indian continent. The vitamin A deficiency, which is associated with the formation of renal calculi. So the patients are majorly found along with the eye diseases, along with renal calculus. Urinary infection, which is the major cause or the major trigger factor in the female patient. Lower urinary tract infection, which is being because of the shorter urethra, the common condition, and then further on it leads to the alteration in the urine, and it causes the urinary calculus. Infection disturbs the colloidal content of the urine, so there is more chance of stone formation. Infection also causes abnormality in the colloids, which may cause the crystalloid to be precipitated. Infection also changes urinary pH, which helps in stone formation. pH is decreased because of the infection, and then further on it is also causing the formation of stone. Infection also causes increase in concentration of crystalloid, which may under some circumstances causes the renal calculus. Urinary stasis provides a fertile field for the bacterial growth. It causes a shift of the pH of urine to the alkaline side. Stasis also predisposes urinary infection, and it allows crystalloids to precipitate. The crystalloids, as we had mentioned first, the four crystalloids which are being precipitated because of the urinary stasis, it is also further on complicated with the infection, and the renal calculi could be formed. Hyperparathyroidism. It is majorly very rare case. Okay, it is found very rarely, up to 2 to 5% of the cases in renal stone. Peculiarly, enough renal calculi are more likely to develop when hyperparathyroidism is mild and prolonged without much skeletal lesion. Okay, without affecting much over the calcium deposition, it will be affecting over the kidneys. Now, the types of renal calculi. Basically, there are two major types of renal calculi, primary stones and secondary stones. In case of primary stones, which are apparently healthy urinary tract without any antecedent inflammation. These stones are usually formed in acidic urine. These stones usually consist of calcium oxalate, uric acid, urates, cystine, xanthine, or calcium carbonate. All such are primary stones or primary renal calculi. Second type, that is secondary stones, are usually formed as the result of inflammation. So the renal damage is more in the cases of secondary stones. The urine, usually alkaline, as urea splitting organisms are most often causative organisms. Secondary stones are mostly composed of calcium, ammonium, or magnesium phosphate. So called. It is also known as triple phosphate. They are also causing the staghorn calculi or calculus, the single calculus which is forming inside the complete kidney, and it is very much dangerous as it is quiescent type of the calculi. We will further on discuss. Okay. Amorphous phosphate and ammonium urate may enter into the composition of secondary stones. Majority of the secondary stones are phosphate stones. Now we will discuss first the primary stones. The first type, that is oxalate calculus or calcium oxalate. The two crystalloids, that is calcium and oxalate, both are combined and forming the calcium oxalate calculus. Okay, it is more often impacted in the ureter. Okay, as it is having the rough surface on the digital X-ray, you may also found such stone with very rough margin, and there is a slight haziness around such calculi because of the inflammatory changes, pyelonephritis in the kidney. It causes bleeding due to its rough surface. There may be deposits of secondary phosphate on its surface which causes the infection and leading to the formation of mixed stone or secondary stone. Due to high calcium content, it casts an exceptionally good shadow in the radiological or radio opaque. The rough surface may also be evident in the X-ray. Second type, that is uric acid and urate calculi. Pure uric acid calculi are very rare and never being visible over the X-ray. So it is required to majorly dependent upon the blood and urine test for such conditions. In case of uric acid stone, pure uric acid stone, which is very rare condition, but if it occurs, then it could not be visible in the X-rays. The majority contains urates and enough calcium oxalate to render such calculus radio opacity. Okay, because of the some portion of urate as well as the calcium oxalate, such calculi are radio opaque. They are slight blurred in the X-rays, but they are visible because of some amount of calcium oxalate. These stones usually occur in the multiples, so are typically faceted. Okay, the stones are of moderate hardness to their covariant, yellow to dark brown. Okay, the third type, that is cystine calculi, as we had discussed. The cystine calculi are also very rare condition. They are majorly formed in the children. Uric acid as well as the cystine calculi, both are majorly formed in the children. Okay, in case of the cystinuria, that is the one type of amino acid which is mixed with phosphate and excreted through the urine. Okay, if it is precipitated, then it forms the cystine calculi. Okay. Pure cystine calculi are also not radioapac. They could not be seen in the X-rays, but further on, As they contain the sulfur, they are usually radio opaque. Cystinuria has been discussed as majorly seen in the young girls. Okay. Now the fourth type, that is xanthine calculi. These are extremely rare. They are having a very smooth surface. They are majorly without any kind of the pain or without any kind of sign and symptoms. Round, brick red in color. Fifth type, that is indigo calculi. They are very uncommon. These are blue in color and are derived from indican formed by the decomposition of tryptophan in the intestine. Okay, so they are also very uncommon. Now further on discussing about the secondary stone, as we had first also discussed very some aspect about the phosphate calculus, also known as triphosphate calculus, triple phosphate, as it is containing the three different types of the phosphate: ammonium phosphate, magnesium phosphate, as well as the calcium phosphate. So it is known as triple phosphate. It also forms the staghorn calculi. Such stone enlarges rapidly and gradually fills up the whole renal calycis to take up the shape of staghorn calculus. As this stone gives little symptom due to its surface, smooth surface, it enlarges rapidly. Triple phosphate usually result from the liberation of ammonium carbonate brought about by urea-spitting organisms, while majority of such stones are made up of calcium phosphate. A few are made up of mixture of calcium phosphate and triple phosphate. Okay, so when they are made up of from the triple phosphate, it may go further on enlargement and it is found as a staghorn calculus, mixed stone. Phosphate stone may occur as a covering of primary stone. Okay, primarily there will be calcium oxalate stone and then there is covering of that calcium oxalate stone along with the phosphate. Then further on it is known as a mixed stone. Such stones are known as mixed stones. The primary stone is often the calcium oxalate stone. When the urine becomes infected, deposits of phosphate occur on the rough surface of calcium oxalate stones. Okay, so it is associated with UTI. Now we will discuss the pathway of stone. Okay, in this GIF you can see that the stone is formed from the renal pelvis. Okay, it is first attenuated at the PUJ junction. That is, okay, here around the PUJ, the pelvic vesico junction, over which the stone is majorly stagnated. Further on, it may stagnate anywhere inside the ureter. Okay, it may get blocked over the ureter, and ureteric stricture may arise further on complication. At the end, over the ureteric sphincter, it may get blocked just before the urinary bladder. Okay, and at last, over the it may get blocked over the commission of urethra. Okay, so the urethral sphincter may also causes the blockage of renal calculi. That may be the full course. And alongside the clinical symptoms, the clinical features are depending. Okay, majorly the symptoms, the pain which is eliciting along with the different parts which are being affected. The clinical features. We will first discuss the symptoms and then later on we will also discuss the signs. As the symptoms are very much elicited along with the pain, but the major condition, the major dangerous condition in the renal calculi is quiescent calculus, which could damage the renal and further on may cause the renal failure. Okay. The first type, the first type of pain, that is no pain, quiescent calculus. Majorly, a few stones, particularly the phosphate stone, may lie dormant for a quite long period. During this time, the stone gradually increases in size with the destruction of the renal parenchyma. Sometimes it is accidentally discovered by the X-ray, which is performed for some other reason, and it will be the first relevant for such quiescent calculus. Sometimes such stones are also discovered due to symptoms of urinary infection. There is no pain, but the UTI which is being suspicious of the calculus, and then such quiescent calculus came apart. When the stone is still in the submucosal stage or adherent to the parenchyma, it may be symptomless. Even the staghorn calculus may be asymptomatic, but the gastrointestinal symptoms may alongside along with such quiescent calculus. Second, when there is pain, there are the different type of the pain. Okay, three different type of pain. The first, that is fixed renal pain, which is majorly occur when the renal angle is only affected. If the stone is free and obstruct a calyx of uretropelvic junction, there will be dull flank pain due to the capsular and parenchymal distension, dull aching or boring type of pain which is experienced in the case of big phosphate calculus. The pain is situated in the renal angle posterior over the lumbar region corresponding to the hypochondrium anteriorly. So, the renal pain which is referring along with the hypochondriac region. This pain characteristically gets worse on the movement, particularly walking up over the stairs and during jolting. If the patient bends, then such pain will be elicited. Second type of pain, that is ureteric colic, when the stone had entered in the ureter and then further on it is majorly referred to the anterior side. Okay, along with the course of ureter. This occurs when the stone attempts to pass down the ureter or temporarily blocks the pelviureteric junction that we had seen, the PUJ, pelviureteric junction. It is an agonizing pain which radiates from the loin to groin. The pain comes suddenly, during which the patient rolls about, drawing up his knees towards the chest, tossing on the bed in agony. This colic is also referred as renal colic or ureteric colic. It is associated sometimes with sweating, nausea, and vomiting. The pulse is also increased as we know that the same segments of the autonomous nervous system is supplying along with the iliohypogastric and ilioinguinal nerves which arises from the T11, 12 and L1 nerve roots. The pain, sometimes the pain is also referred to the scrotum and to the inner side of the thigh along the distribution of genitofemoral nerve. So that is ureteric colic, also referred as a renal colic. Okay. Now the third type of pain, that is referred pain, which is very rare, and sometimes such pain is also referred to all over the abdomen. Okay. Sometimes Such pain may also occur, but the majorly fixed renal pain and ureteric colic, this both type of pain occurs subsequently. Okay. The quiescent calculus and the referred pain, which are very rare conditions in the pain. Okay. Now, hydronephrosis, which is also one of the complication, but we will discuss it along with the clinical features, as such conditions are also to being understood, which is majorly associated with the renal calculi. In case of hydronephrosis, sometimes patient complains a lump in loin. In loin region, there is sensation as if lump and dull aching pain, which are due to hydronephrosis caused by the renal calculus. Occasionally, hematuria, blood in urine is also leading and the only symptom. Hematuria usually occurs in small amount, which makes the urine dirty or smoky during or after an attack of pain. Okay. Hematuria, which is associated with the episode of pain. If the fixed renal pain or renal colic or ureteric colic had arisen, then later on hematuria may occur. So that is also one important or occasionally only symptom in cases of renal calculi. Now the signs. The first sign is tenderness over the renal angle posteriorly. The angle is between the lower border of the 12th floating rib. A 12th floating rib which could be easily palpated just from the behind and over the middle portion of that 12th rib. The renal angle, which is showing the tenderness over the palpation, over the touch at that renal angle, will be eliciting the pain. The lateral border of the erector spinal muscle, that is compromise, that is forming the renal angle. Anteriorly, such tenderness may be elicited about an inch below and medial to the tip of ninth costal cartilage, which is known as renal point. Okay, renal point is situated anteriorly and renal angle over the posterior portion. Tenderness is more constant feature when renal calculus is associated with infection. Second sign, that is muscular rigidity, which is found in few cases, but the rebound tenderness anteriorly can be also elicited, particularly if the acute infection is associated. Swelling in cases of the hydronephrosis or pyonephrosis associated with renal calculi, swelling over the affected part or the affected side in the flank is seen. The characteristic of renal swelling is the oval or reniform shape. It must be differentiated with the swelling of hernia. Okay, in case of hernia, the swelling must be examined in the standing position. In the renal swelling, which could be also the same over the lying down, the swelling is almost fixed and cannot be moved as it is retroperitoneal swelling. Okay. A kidney lump is ballotable. The swelling slightly moves up and down with respiration, but much less than a liver swelling. Whenever there is liver tumor or associated with hepatitis, the swelling is completely fixed. It is not moving with respiration. The fingers can be insinuated between the lump and costal margin, which is not possible in splenic or liver swelling. Over the right lumbar region, you should differentiate it with liver swelling, and over the left side, it should be differentiated with splenic swelling. A band of resonance can be elicited anteriorly or percussion due to the presence of colon duodenum and coils of small intestine in front of kidney according to the side, but the resonance is absent in splenic and liver swelling. Abdominal distension and diminished peristalsis may accompany ureteric colic. Now, the spatial investigation. As I had told earlier, the spatial investigations are not only limited to the radiography. It is also required to examine the blood as well as the urine analysis. In the blood examination, renal function test must be assessed by the estimation of the blood urea and creatinine. If serum proteins are decreased but total calcium is normal, an increase in ionized calcium, which is indicated for the hypercalcemia, with hypophosphatemia, that is strongly suggesting the primary hyperparathyroidism, which is very rare condition, but in the rare cases it must not be forgotten. Estimation of serum chloride concentration, which is also helpful with the respect if it is above the 102. It is a case of hyperparathyroidism. When it is below, it may be the hypercalcemia from the other causes. Serum hypercalcemia is very much associated with calculus, though it is commonly associated with osteolytic and disseminated malignant disease. If there is no such chronic disease, then you should have the suggested over the calculus formation. Elevated serum uric acid level, which is found in the 50% of uric acid stone carriers. Okay, in case of uric acid stone, the blood uric acid level is increased and it is majorly found in the half of the cases. Now the second important investigations are urine analysis over the routine as well as microscopic. The physical examination, which shows smoky urine, dirty urine due to slight hematuria, or opalescent due to presence of pus. For such examination, you may also suggest patient to give the sample of urine after the episode of pain. Thus, it could be also found the best sample. Okay, as after the episode of pain, urine may contain if there is any fragmentation, if any further on deviation, which is also goes in the chronic cases. So the urine analysis, physical, now over the chemical examination, it shows the presence of protein due to hematuria and blood in urine. pH is also higher than 7.6. Presence of urea splitting organisms. It also denotes that the stone is probably of triple phosphate. In case of the quiescent stone, when there is no sign, when there is no symptom, no pain, over such condition, the urine analysis must be done and the microscopic analysis must be observed carefully. Consist- Consistently low pH is the common cause of formation for uric acid as it is alkaline. A simple chemical test for cystine may be performed by making the urine alkaline with ammonium hydroxide. Okay, that is for the cystine stone. Microscopic examination of urine may show RBCs, pus, and cast. Bacteriological examination when it is associated with infection. Renal function test should always be preferred in the calculus test. Now over the radiography. The straight X-ray of the KUB, that is containing both kidneys, ureters and bladder, urinary bladder, kidney, ureter and bladder region. Straight X-ray will reveal 90% of renal calculi, as majorly are radio opaque and are easily visible in a plain film of KUB region, unless they are very small or overlying over the bones. Staghorn calculus, which is very easily being found after the urine analysis, majorly it is remarked after urine analysis. There is no confusion with other radiopaque shadows. It is necessary to differentiate renal calculi with the ossified tip of 12th rib. Sometimes it may be confused along with the calculus. Okay. Gallstone. In case of the right renal calculi upper calyx which is being affected, so it must be having the epi and lateral, anteroposterior as well as lateral view. Okay, both view must be taken. In the lateral view, whenever it is the retroperitoneal, it is backward rather than polylithiasis which is in front of the right upper calyx of renal, a calcified suprarenal gland, a calcified tuberculous lesion of kidney. This all must be differentiated in the X-ray. Excretory urogram, retrograde urogram may be needed if excretory urography failed. Ultrasonography is being helpful to distinguish the opaque and non-opaque stones. It also very much value for the further on, if it is surgically treated, that is ESWT, extracorporeal shock wave therapy. We will also discuss it now further on, and also over the renal scan and in the instrumental examination, cystoscopy along with the catheterization, which is also being used for the ESWT, ultra extracorporeal shock wave therapy. Examination of the stone. If the chronic patient, if the patient had also suffered in past from the same complaint, that is from the renal calculi, the stone examination will be very much helpful as it is likely to being affected from the same type of the renal calculi. Okay, now we will discuss about the treatment aspect. Okay, first of all, the extracorporeal shock wave lithotripsy, percutaneous nephrolithotomy, and ureteroscopy. These three subcutaneous surgical aspects which are being very much helpful in the cases of renal calculi. Nowadays, that's why the open surgeries are very rare. Okay, as these percutaneous methods are mostly selected when the stones are majorly more than 6 to 8 millimeter in size. If the stone is smaller in size, we are very much helpful with the homeopathy as we could easily remove such stone with the medication, okay, within few time limits. Okay. But the percutaneous methods are also very much helpful in the larger stones. But further on, homeopathy will also used when there is the reoccurrence of the renal calculi. Now, the first method, that is ESWL, extracorporeal shock wave lithotripsy. The urinary calculus is bombarded with shock waves of sufficient energy so that it disintegrates into the fragments. In the original Dominier machine, the shock waves were generated by an electrical discharge placed at one focus of an ellipsoid mirror, which will concentrate the shock waves to the calculus. Okay, that we will see in the next slide. The patient is so positioned under the radiographic control and by placing a second mirror in such a position that its focus corresponds to the position of calculus. The second mirror majorly placed behind the patient and the machine is positioned above the patient. We will just see in the second slide. Both the patient and the shock wave generator are immersed a bath of water. In present days, water bath is not being used. The fluid is confined to the path of shock waves. Okay, but nowadays it is not required in water. The shocks may be generated by the discharge of an array of petroelectrical cells and they may be aimed by the ultrasonography. Okay. Ultimately, along with the ultrasonography, the ESWL which is being performed, but in case of staghorn calculi, it is required the both type of the percutaneous methods, that is PCNL as well as ESWL. We will just see the two images for the ESWL. Here in the first picture you can see the different stages of ECSL or ESWL, extracorporeal shock wave lithotripsy. And in the below image you can see the emitter, okay, how the emitter is placed in the elliptical refractor. So it will be formed the all shock waves to the particular point, and it will damage the stone, and the fragments will be excreted through the urine. The second mirror is placed beneath the kidney, which is seen in this diagram. The second mirror, which is placed beneath the renal calculi. Okay, so this is ESWL or ECSL. Now the second surgical method, which is known as percutaneous nephrolithotomy, in short PCNL. It is minimal invasive procedure to remove the stones. Mostly the puncture is performed from the posterior aspect in the kidney about up to 1 centimeter. It is most suitable to remove stones for more than the size of 2 centimeter in size, which are present near the pelvic region. It is usually done under the general anesthesia or spinal anesthesia. It allows safely and reliably removal of stones from the pelvic calcium system and from the upper ureter up to the upper ureteric stone. We could use PCNL, otherwise ESWL will be used. With the patient in the prone or oblique position, the access to the pelvic calcium system, which is secured by the nephrostomy tract directed through a suitable placed calcix. This tract is then dilated to allow the passage of the instrument which is used for the stone removal. The stone is visualized along with the telescope. If the stone is quite small, it can be extracted through the nephroscope. If the stone is quite large, the ultrasonic lithotripter, which is being used to break that stone, and the nephrostogram, which is being performed after the 48 hours post-operatively to confirm the absence of extravasation and free passage of contrast to the bladder, allowing the removal of nephrostomy tube. It is also known as stent. The stent is placed along with the ureter in case of the PCNL. In the event of retained fragment, the nephrostomy tube can be left in situ to allow the further PCNL or irrigation of chemolysis required. Okay, so that is the small procedure of PCNL majorly performed when the stone is more than size of 2 centimeter. So around 10 millimeter or more than 10 millimeter. This is the brief process of PCNL. The first, the nephroscope is being inserted. Here the staghorn stone. This is one type of the renal calculus that we had discussed just now. There is staghorn stone. Okay, and it is being removed. Then lithotripsy, the same which is being extracorporeally performed, which is being inserted inside the kidney, inside the renal calyx, and then the fragments are being absorbed. So that is PCNL. Now we will in brief discuss about few open surgeries which are being very less being used, but it is also used. And then last we will discuss the preventive measures for the renal calculi. Okay, so majorly when such renal calculi is occurred, it is required to being treated and majorly when the patient can, it is being very large. So the surgery is the option. But then further on, you could prevent it. You could even go for the medication if the stone is small. The open surgeries like pyelolithotomy, second that is nephrolithotomy, combinedly known as pyelonephrolithotomy. Okay, in case of the pyelolithotomy, the lumbar approach is made and from the posteriorly, kidney is mobilized and drawn towards the wound. And then further on, it is grasped by the left hand and the area is surrounded by the removal of stone through an incision on the pelvis of kidney. Okay, when the stone is lying over the pelvis. Okay, such procedure could be performed. When the stone is lying over the renal parenchyma, nephrolithotomy is performed. Pyelonephrolithotomy, whenever there is requirement of removal of the stone through the both pelvis of the kidney through the renal parenchyma, then it is known as pyelonephrolithotomy. Partial nephrectomy, that is the indication of renal calculi when the stone is located at one pole of kidney. Majorly it is very rarely, but if it is required, the partial nephrectomy is performed nowadays when the stone is situated above the renal pole. When removal of stone may damage the calyx, the partial nephrectomy is performed. In case of stone impacted in the lowermost calyx, partial nephrectomy is performed. Okay. And it will also decrease the chances of recurrence. Nephrectomy, stone with gross infected kidney or pyonephrosis, stone with gross hydronephrosis with non-functioning kidney, the nephrectomy is performed, and multiple stones which are scattered in the kidney in the different calyxes. All such conditions are indicated for the nephrectomy, removal of the kidney. It must be remembered that the contralateral kidney must be proved healthy before considering such operation. That the opposite kidney must be healthy and must be sustainable for the further on renal function. Otherwise, it will be damageable. Exposure of kidney. Okay. Further on, sorry. The last type of open surgery, that is nephrostomy. The renal pelvis or renal parenchyma is drained to the exterior to the loin with or without removal of calculi. Stone with pyonephrosis and the patient is too ill to stand any operation, then the nephrostomy is performed. Whenever there is calculus, anuria, nephrostomy is indicated. When ureteric catheter cannot be passed above the obstruction, in such cases, the nephrostomy is performed. Now further on, we will discuss about the recurrence of the stone. Okay. The first thing, that is false recurrence. In such cases, when the few renal calculi are remained inside the renal calyx, Okay, tiny stones were overlooked at the time of operation, majorly or sometimes in case of PCNL, such condition could occur. Okay, and the second thing, that is the true recurrence. Afterwards, we will discuss the homeopathic management. We will also discuss the homeopathic therapeutics. Okay, but these two things which are very important for the homeopathic management as well. Okay, in case of false recurrence, we could majorly go along with the therapeutic approach. We could face the patient as well as we will further on go along with the therapeutic approach. Okay, and in the case of true recurrence, when there is the tendency of the patient that the attempt should always be made to prevent such reoccurrence. Okay, in such patient there is very much reliability of the doctor, so they don't suffer from the same disease condition. All the patients with renal stone don't require surgery when the stones are sufficiently small. This can be naturally eliminated, and expectant policy is the best adopted in these cases. In the elderly, poor risk patients, a coralliform stone is best left alone. That is staghorn stone. If there is formation of staghorn stone, but the other kidney is not being affected, it must be left alone. It must be left as it is. Otherwise, it will damage the opposite kidney as well. Okay, it will also damage the complete renal function, and it will be harmful for the patient. Chemical dissolution of renal stone requires indwelling uretral catheter for constant through and through irrigation. Now I will discuss first the one case which uh, occurs prior 2 years. Okay, uh, there are also few other cases which came along in between, but this case had been the best example from which we can secure the patient with many different aspects. Okay, we could help the patient along with the financial as well as the mental as well as the social level. This patient had came with the bilateral renal calculi, male patient with around 24 years of age. He had been diagnosed with the plain X-ray, which is taken on the 31 of January in 2018. This is the report of that the first diagnostic X-ray. Okay, that is also being taken digitally. In this report, we could see that the both kidneys are normal. Okay, but the both kidneys are with the presence of few stones which are also in middle calyx, which are being very easily being treated medically. Okay, so the medication is given to that patient, homeopathic treatment which is being started with. Oh, I had explained to the patient that it is very easily being with the homeopathic treatment and easily being excreted. Okay, it will be expelled out within some time of period. Okay, but the patient had planned for the ESWL in the next month, so I had given that give the 1 month and it will be easily expelled. Okay, so the after 1 week, during the 1 week as well, the pain is being subsided, it is decreasing. And then further on, after the completion of 2 to 3 weeks, the calculus are also being expelled. The calculi, both renals, are being free of calculi. He had not even complained of the hematuria as well as any further on. And the repeat X-ray I had suggested him repeatedly, and at last he had taken the repeat X-ray in March. So over the March 16th in 2018, the X-ray KUB which shows the no radioepic shadow in either kidney, ureter as well as the bladder region. So this approach is very much helpful for the renal calculi. In Gujarat, there are also major patients along with the renal calculi as they are having their water intake properties. Okay, they are having very likely to be the earth water. They are having drinking such impure water which causes typically in the renal calculi. Okay, and such renal calculi which are being tragically to such poor patient who could be easily helpful with the homeopathy. In the other pathies, majorly I am not enumerating anything, but they are very likely to being financially burdened as well as the mentally and the socially. The patient will be tired up along with the treatment side. Within few weeks, we could expel very tiny renal calculi easily, and we could also affect over the larger renal calculus as well. Okay. The homeopathic management is containing over the few medicines. I am enumerating very few, but there are large number of medicines as well as the constitutional remedy could be also very much indicated in the recurrent renal calculus. The first medicine, that is cantharides. There is oversensitiveness of the all parts, the constant urging to urine. Drinking even the small quantities of water increases the pain in bladder. Cantharides is also one of the best homeopathic antiseptic for the urinary tract infection. In the cases of UTI, majorly the female patients who are suffering from the recurrent UTI, Cantharis is the best. There are intolerable urging before, during, and after urination with violent pain in bladder, burning and cutting pain in urethra during micturition, violent tenesmus. The burning pain and intolerable urging to urinate is the keynote for cantharides. Second medicine is sarsaparilla. It is indicated for the dark complexion person with the psychotic or lithic diathesis. The diathesis itself is having the formation of stone. There is severe, almost unbearable pain at the conclusion of urination. Such symptom is also seen in the Berberis vulgaris, Medorrhinum, Thuja, and Sarsaparilla. There is passage of gravel or small calculi. So sarsaparilla is the best indicated medicine for the urethral calculus. Renal colic, stone in bladder, hematuria. There is scanty, slimy, sandy, copious, and urine passed without sensation. Deposition of white sand, painful distension and tenderness in bladder region, urine dribbles while sitting, standing, and passes freely. Sand in urine, child screams before and passing urine. It is also important for the renal calculi in children. Third medicine is Berberis vulgaris. It is indicated for the renal or vesical symptoms, predominantly pain in small of back, very sensitive renal region to the touch, which is also aggravated while sitting and lying. Burning and soreness in the region of kidneys, burning and soreness with numbness and stiffness and lameness. In short, we could also uh, remember Berberis vulgaris with BSNL, burning, soreness or stiffness, numbness and lameness. Lameness in the renal region, which is key mark for the Berberis vulgaris. It is also associated with the rheumatic and gouty complaint like the ossimum canthi, which is also indicated in the uric acid renal calculus. Berberis vulgaris is as well indicated. It is majorly indicated for the left renal calculi, left renal ureteric as well as the left side of the renal colic. Rubbing sensation in kidney. Next medicine is lycopodium, which is indicated very similarly like the Berberis vulgaris, but it is indicated for the right side. Lycopodium is majorly indicated for the right side of renal calculi. It is also indicated in the case of children when the urethral stone occurs in the children. Other medicines which are specific for the renal stone are hydrangea, Chimaphila, Pararia brava, Puarusi. Okay. As in the kid flame, there are also the combination of 8 quality of these few medicines. Okay, they are also in the decimal scale. They are being proved in the different patients clinically as well. Okay, so the kid flame is also one of the utilized medication in the cases of renal calculi. Okay, so I am very much thankful for the all participants who had listened carefully. Sometimes, if the voice is also not clear, sometimes if there is some other mistakes while the presentation, okay, and also the regards for the errors.
Thank you so much, Dr. Viren, for the wonderful webinar. I'll request doctors, in case if you have any questions, you can please ask to Dr. Viren. Meanwhile, I will be sharing a link with which you can get the digital certificate after sharing the feedback. I've just sent the link in the chat window. Any questions that you have? Dr. Viren, I think it was a very enlightening session because you have covered each and every point very wonderfully, and then you have talked about the treatment also. So there are appreciation message for you in the chat window. I can see many doctors are appreciating. So we have one question also. How much size we can try for homeopathic management, and if the patient has hydronephrosis, do we need any other medicine? So you need to unmute,
Yes,
Dr.
yes,
Viren.
yes, yes.
Yeah.
First of all, it is required to take the perfect diagnosis. Okay, why the hydronephrosis occurs? Okay, it is also another one particular topic for the such whole presentation. But the hydronephrosis, whenever it is associated with the renal calculi, and if the renal calculi which is being stuck over the ureter and causes hydronephrosis, it could be easily treated with the medication, as I had just told. Okay, so okay, so.
Right. There is another quick question from Dr. Shweta. What should we do if patient is in severe pain?
Okay, so in such condition, in the condition of the severe pain, which is very rare, if the patient is taking the abundant amount of water, as I had talked earlier, the output of urine which is being measured, okay, the output of urine which is more than 2.5 liter, and then further on it could be easily taken up with the condition. Uh, okay, so if there is severe pain over the renal point or over the renal angle, it is also being required to differentiate it with the past history of the patient. Why there is such severe pain? If all the precautions are being taken, if the infection is increased, then further on immediate operation could be also suggested.
Okay. So Dr. Sapna wants to ask, can you please explain hydronephrosis grading?
Pardon?
Hydronephrosis grading.
Hydronephrosis are graded over the four. Okay, there are four grades of the hydronephrosis. If the complete ureter is being accumulated with the fluid, Then it is the fourth grade hydronephrosis, which is very severe and the harmful condition for the particular side of the renal or kidney. Okay, so the fourth grade hydronephrosis, which must be taken care, which must be immediately treated surgically if it is required.
Okay, okay. So anything that can be suggested for multiple calculi?
Yes, as I had told, in the case of multiple calculi, the nephrectomy, which could be performed, the open surgery, which could be performed in cases of multiple calculi. But I would strongly recommend in each and every case of calculi, in each and every disease condition, that the homeopathy must be taken first, as there are miracles in the homeopathy and it could be easily treated with the homeopathy, and further on it could not complicate if the surgery is also being performed. So in case of multiple calculi, we go for the open surgery as well if it is required.
Okay.
Okay.
Okay, so
I could
do we
also
need?
read I could also
Hmm.
read one question. Can homeopathic medicine break the stones? Okay, it is also the stone breaker, Pareria brava, that I had just enumerated but cannot go in detail as we are very few in time and I had also go to my clinic. Okay, so the Pareria brava, which is also known as stone crusher. Okay,
Right, right.
Gujarati ma, it is also known as pathar fodi. Okay, it is directly prepared from the same plant.
Okay.
Okay. The plant which grows out through the stone, and it is also having the character to break the stone.
I
Okay,
think
so
break the stone and dissolve the stone, both the things are
both.
available in homeopathy.
Yes, sure.
And yeah, all right. Thank you so much, Dr. Viren. Keeping your clinic time in mind, we
Yes,
won't take much time now. Thank you so much for taking the wonderful session, and thanks to the audience also for being there. We also have one product that Dr. Viren has also mentioned for renal calculi and renal inflammation, and that is Kid Flame tablets. Kid Flame contains 8 ingredients, and it is internationally and Indian clinical research product. The dosage is 2 tablets 3 times a day, 1 to 2 tablets depending upon the patient. So thank you so much. The link for the certificates we have shared in the chat window. You can just click on the link and you would be redirected to a Google form. There you need to just fill the form, and you will get the digital certificate directly on your email ID. In case of any other information, you can connect with us anytime. The contact details of Bhargav Phytolab are 9599969785. Thank you so much. Have a good day. See you tomorrow at the same time with a different webinar topic with a different speaker. Thank you.